Son.
I do have the
There it
goal
goes.
on.
Now it hit.
Okay.
Good afternoon, everyone. Thank you for coming. This is the State Agency Roundtable discussion for the next annual action plan for in support of the 2020-2024 Consolidated Plan for Housing and Community Development. My name is Michael Santoro. I'm the Director of Policy Research and Housing Support for the department, and I'm supported today by Laura Watson, my planner et al. Thank you, Laura, for all the coordination that you do. She sent out in advance today's agenda, as well as some informational material on our current priorities. Rather than go through and have everybody introduce yourselves, what I would say to you is, since we have a record of it through Teams, if you do want to speak, you do want to provide input, please tell us who you are and what agency you represent. This should be state agency and related parties only for today's roundtable. The one exception I know is Mackie from the Green Bank. Thanks for coming, Mackie. Appreciate it. Only because they are a trusted partner with the state of Connecticut with regard to energy-related activities. And a lot of what we're all doing these days is energy-related, and they're running a couple of programs for us and for DEEP. So happy to have them on board. I'm going to share my screen real quick. On the left, you can see the agenda. On the right, are the proposed priorities for the programs covered by this 5-year plan and the action plan. Just so you're aware, very shortly, you will see notifications for engagement around the next 5-year consolidated plan for housing and community development. We actually have to start that well in advance. That is for the year that begins July 1 of 2025. So when you see it, don't think you've already done it. That's a whole new process, and will involve a great deal of additional input from all of you, hopefully. This is the 5th of the 5-year plan annual action plans. So we support and go off of that original 5-year plan and the priorities identified in that plan. Let me blow this up a little bit so you can see it a little more easily, even though everybody got it in email. We'll go through real quick. The 6 programs that are covered by this annual action plan are the CDBG Recovery Housing Program, or RHP, the CDBG Small Cities, or Community Development Block Grant Small Cities, the Emergency Solutions Grant Program, Housing Opportunities for Persons with AIDS, the National Housing Trust Fund, and the Home Investment Partnerships Program. This is pretty much the same as we have done each of the prior 4 years. Again, I'll go through real quick. Since you have this, if you have comments, questions, or concerns about any particular program, please raise your hand. Teams will let us know who came in first. We'll get to you. The intent here is, this is the pre-plan conversation. That is, prior to actually writing our 5th action plan in support of the consolidated plan, we're required to engage with you, our community partners, and any other interested members of the general public before we actually craft a plan. You have in the past contributed significantly to that plan, and we appreciate all your prior assistance. We would appreciate you taking a moment, look through our priorities. If you have comments or questions, we will also accept pre-plan comments. But if you have questions, please do not hesitate to reach out to either myself or Laura. Happy to answer any questions you might have. But if your agency wants to tailor a priority more than it has in the past, or you have a new idea, in particular as we plan for the next 5-year plan, or a new concept, please share it. You don't have to share it today, but we look forward to you sharing it. One thing I want to emphasize, and I'll get to you in 1 second, Alice, is interagency collaboration is key for us to be as successful as a state agency as we can. We have and continue to push interagency collaboration. Many of you in the room are very familiar, and we continue to be happy to work with you over time. Alice, you're up.
Thanks, Michael. Hi, I'm Alice Minervino. I am the Director of Housing and Homeless Services for the Department of Mental Health and Addiction Services, and I just wanted to put on the record that we would really like to continue to see continued funding for the diversion with the CBGD funding that for small cities. It's really important to talk about diversion as it relates to homelessness and having people not enter our system as quickly and as efficiently as possible.
Thanks, Alice. I appreciate the comment. And just so that we're clear for everybody in the room who may be new and not know, part of the way that we deal with homeless prevention is diversion. And basically what that means is you identify, or an individual household self-identifies as potentially entering or needing to enter the homeless system. Diversion allows us to intervene in advance and prevent them from actually having to enter the homeless system. It's very much like a preventive medicine. It doesn't get a lot of press. There's not a lot of data that can support the activities that you're doing, other than this is the number of households that we diverted. So when you look at the homeless numbers, think in terms of this is a household that didn't and doesn't show up in those homeless numbers. So thank you, Alice. We will be happy to pass that along to the CDBG folks as part of their continuing activities.
Great, thank you.
Thank you. I'm going to run through these real quick, and then if anybody has a comment or a question, or you want to again tweak a priority, or comment on a priority as it exists, please, we're happy to take it. RHP, the Recovery Housing Program, we have had trouble getting this program off the ground. I'm put it right out there, and I see Steve smiling. We need your help. It's very limited in what this program can do. It has to be directly tied to the creation of a recovery housing program, the production of units or housing opportunities for persons in recovery. I know that we are the intent is to continue to work with our 2 continuum of care, and we are continue to try to coordinate with CSSD, the Court Support Services Division of the Judicial Branch, in getting a pilot set up. So Steve, Mike Aiello, since I see you're here, we got to move. HUD is looking at us and going, you guys aren't pushing this money out the door. It is a pilot. It ends next year. So we need to get something out the door and get this money spent. Okay. CDBG Small Cities, as Alice pointed out, in the past, we have spent money not just on public housing modernization, preservation, public infrastructure, and public service. In particular, the component of public service we focused on was homeless diversion. Alice will be happy to share that with our CDBG folks and encourage them to include new activity associated with diversion. ESG, formerly known as the Emergency Shelter Grant, is Emergency Solutions Grant, and by the old name, the money predominantly goes to target our shelters in support of the shelter-related activity. For those of you who are aware, the Coordinated Access Network is part of that system, but it also it does things peripheral to the Coordinated Access Networks. Steve, you want to add anything here, particularly about ESG?
No, just that we recently completed our rebid of the whole entire homeless service system, including funding that came from ESG. So we put out those award notices a few weeks back, so that's all good. But nothing really new has come of that. We still are required by the program rules to maintain 40% of the funding for rapid rehousing, and we continue to do that, but we've been able to put most of the funding that's remaining into to help funding the shelters, because we know that they're struggling right now. But as you can see the breakdown there that is in the presentation.
Thank you, Steve. And we have a comment or question. Andrea, please introduce yourself and the agency you represent.
Good afternoon, everyone. I am Andrea Barton-Rees. I'm the Commissioner of the Department of Social Services. I have a question around housing and people who are moving into the community from more restrictive settings, particularly nursing homes. I didn't really see that interest represented here, but I do know that as the nursing home industry is changing, many will close, some will convert into other types of housing, and the one thing we cannot find is an adequate supply of appropriate housing for people who want to live more independently outside of that restrictive setting and in their communities. So I don't know where that fits. That's why I'm asking the question.
Certainly, Commissioner, and thank you for coming. It's a pleasure to meet you and a pleasure to have you here. You and your staff are aware of a program not affiliated with these called Nursing Home Diversification. We have bond dollars that we have used in the past in coordination with your agency to actually help in that conversion. It leverages the CMS dollars. Dawn Lambert is the staff person we've most often dealt with in the past, but I know my commissioner has recently started talking about reopening the Nursing Home Diversification Initiative. Happy to have a further conversation. These programs don't directly fit well with nursing home diversification. That is, the programs covered by this particular federal plan, because this plan covers just those 6 programs. But we have resources and we have initiatives ready and available to assist you and your staff. I believe my commissioner is working on getting a meeting set up between your agency and ours to specifically talk about the initiative. I will be participating, and I am most intimately familiar with the nursing home diversification activity. As a matter of fact, we're conducting some research in advance of that meeting. My staff and I, and Laura in particular, was working on that, and another of my staff members, Connor Quinlan, who is also here, has been working on that data. So look forward to having that conversation. But thank you for putting it on the table.
Thank you.
I thought I saw another hand. I did. John Slifka, please introduce yourself and the agency you represent.
Thank you, Michael. Nice to see you, my friend. Jonathan Slifka with Aging and Disability Services. So 3 things, Michael, and you hear me say some of this every year, but I'm going to try to frame it a little bit differently in order to gain some knowledge for myself. Number 1, I'd like to see more, what I don't see here is any language with respect to accessible housing, which of course is important to the disability community. There's 50+ million Americans that identify as having a disability, and that makes them the largest community in the country. And so I'm curious as to why there are no national housing programs either that are out there or that we might be participating as a state to address those needs, particularly since we're doing so much with the homeless. And that ties into my next question, which I'm wondering if the federal government requires any demographic data on those that take advantage of any of these programs. I know that disability is certainly something that it's voluntary. You can't ask someone if they're disabled, and I get that. But I'm just wondering, because both the aging and disability community being the vulnerable communities that they are, there is a homelessness component to both of those communities that we should be mindful of. And so, and again, we're the 6th or 7th oldest state in the country by average age. So I may have rambled a little bit there, but if you could speak to that, that'd be great, Mike.
Thank you. Not at all, John. No rambling, and I appreciate the comment. As we do, as you know, any housing that we build has a required handicap component in terms of handicapped accessible and disability accessible units. We also have programs, again, outside of these that are specifically targeted to accessibility related issues, loans for accessibility, I should say loans and grants for accessibility through the Corporation for Independent Living. They monitor and administer that program for us, which I hope you and your agency are aware of. And if you're not, please let us know. We can absolutely put you in touch with the loans and grants for accessibility folks, so that if you have clients who have needs, we can attempt to help make those accessibility modifications. Since Steve is here and I can't speak directly to the role that disability services plays in the homeless system, I'm pretty certain that it does. But Steve, if you want to elaborate a little bit on anything that you are doing on that side of the aisle, would be appreciated.
Sure. I think when you look at the homeless service system, obviously we have a pretty entrenched relationship with the Department of Mental Health and Addiction Services, because a large percentage of those experiencing homelessness have either mental health or substance abuse disorder. So that tends to be the major historical agency that we've partnered with in terms of disability services. However, in the recent years, specifically the last couple of years, we have started to notice an increase in elderly homeless as rents have gone up, and unfortunately, Social Security and other income have not kept pace. That has led to some poorer outcomes. So those are things that we're dealing more on a case-to-case basis, but clearly we would love to connect more with Aging and Disability Services to see if there's anything that we can partner with. Obviously, if there is a unit or a voucher that is offered to an individual that has mobility or other needs, we make sure that we find those type of units to be able to satisfy the needs that they have so they can live comfortably in the community. But anything that we can further do to bring either more resources or more partnership to the table would be welcomed.
Thank you, Steve. I appreciate it. John, again, happy to take the note, happy to try to talk about it. And in particular, as we plan for our next consolidated plan, if you have data around the needs of the disability community as it relates to the homeless or not, we are always looking for new data sources and new data streams that will bolster the arguments and the priorities associated with that next consolidated plan. Before I move on, anything else, John?
No, thanks, Michael. I really appreciate it. Thank you both.
Thank you. I believe next up is Tamara. Tamara, please introduce yourself.
Hi, Tamara Lopez with Department of Social Services. Hi, Mike. Hi, everyone. I just wanted to, I know this was a while ago. I just didn't know how the data was being used from the RFP that we did forever ago that broke down kind of what the housing looked like in Connecticut in terms of accessibility. It was forever ago for me, so I just I just wanted
Sure.
to make sure that we were also using that data to support kind of the development of the plan as well.
Yo, absolutely, and thank you, Tamara. So the disability study that Tamara is talking about was financed in part by the Department of Social Services, managed and coordinated by DOH. That data is available. It's on our website. And we've actually used it twice already for 2 other plans. And it's being used by the Office of Policy and Management, as I understand it, as part of the housing and segregation plan that is currently approaching publication. Cross my fingers. So yes, that data has been extremely useful, extremely valuable. We do plan to use it as part of our next consolidated plan for housing community development, that next 5-year plan. So from our standpoint, it's been extremely helpful, extremely useful. When we look at need for housing in terms of geography, it plays a very important and key role. So
Did it touch on some of the stuff that John was just talking about in terms of accessibility? I felt like it might have. That's one of the reasons I brought it up. I wasn't certain though.
Well, I got to be honest, I don't remember
Yeah, me neither,
Actually,
that's why I
I'm
was
gonna,
hoping.
I mean, it was,
It was a while
was
ago,
that,
but
was that pre-COVID or was it the very beginning of
it
COVID?
was borderline.
Yeah, yeah.
I
So,
still I still had a belly. It was borderline.
yeah, okay. And I'll apologize in advance. COVID has just completely messed up timing for me in terms of what we did when, how we did it. I'm sure a lot of you have the same experience, and I tend to talk about things now in terms of pre-COVID, during COVID, post-COVID. So thank you, Tammy. But I have to go back and look at that data. So I see two people, and I think first up is Michelle. Please introduce yourself and your agency.
Hi, everyone. I'm Michelle Dumas-Kuhler, and I work at the State Commission on Human Rights and Opportunities. We're the state enforcement agency for the discrimination statutes in Connecticut. And while we don't provide housing, we certainly make housing accessible to folks who have been discriminated against in their housing search, which it sounds like a lot of you are experiencing. If you are encountering inaccessible housing for people with disabilities, or you're encountering struggles with finding housing for people because of their age, their disability, their income, those are all the complaints that the commission accepts. Our services are free. We investigate and prosecute those cases because they're violations of our state statute. And so that has a long way of going for people and housing providers to know that these things are discriminatory, and it does open up existing housing. And it also makes sure that housing that's being built is built accessible and adaptable, which are requirements of our statutes and the federal statutes. So just sending a shout out to the Commission on Human Rights. Please come and file your complaints with us, because there's a lot of that going on too. So just thank you.
Thank you, Michelle. Appreciate it. And absolutely, the department has a long history of working closely with CHRO, not just on the new activity that we carry out, but with regard to these kinds of issues. We get reports all the time, and we refer people regularly to CHRO. I encourage all of you, if you see or feel or hear about something which has the potential to be discriminatory, send them over to CHRO. They will look into it. They will make the decision or the determination as to whether it is in fact something that's pursuable, and they do a great job over there. So thank you, Michelle. Appreciate it. Commissioner Reeves, another comment or question?
I do have another question. I appreciated the response that you gave to Jonathan Slifka when he asked the question. I guess the challenge that I'm having is that when we are within the context of making sure, to the CHRO representative's point, that when housing is built, there's a certain percentage that's built so that it's accessible. It's I guess because the need is growing so much because people are aging, that just having that certain percentage set aside doesn't seem to be keeping up with the demand. And so that's part of the challenge. And then the other part of the challenge is that coming to the CHRO or to the Department of Housing as needs arise or as discrimination occurs means that we're dealing with it on a case-by-case basis. So I'm wondering, as we're building our agenda, if there's a way for us to collectively have a more proactive approach in terms of quantity of housing rather than a percentage and I'm hoping that the question that you asked Jonathan with respect to providing data can help drive us to be more proactive, to build more, right? And to also may perhaps incentivize current landowners to convert more so that we can have more capacity. I think that's what we're really looking for.
Thank you, Commissioner. And one of the things that, again, outside of these programs, but one of the things that we have done and we continue to do in coordination with the Interagency Committee on Supportive Housing and Homelessness is to create PSH, or Permanent Supportive Housing. And those projects have a greater percentage of handicapped accessible units as part of the nature. We actually did an initiative with DDS. Again, I want to say it was pre-COVID, and we're looking at reinitializing that. It was called IDASH. It was units specifically targeted at individuals with intellectual disabilities or were on the autism spectrum. and we're looking at recapitalizing that activity and actually making some adjustments to make it even more effective than it was before. So, Commissioner, thank you for your comment, and you just opened the door, so we're going to invite you to the table as we go down that with the Department of Developmental Services. So this is an opportunity for us to grab you and
Okay.
bring you to the table. So thank you.
Well, I will tell you that my former commissioner, I see him on, Jordan Sheff, will tell you that I did build an IDASH community in Hartford.
Wonderful.
So, yeah, so I know very
Well,
much.
while I
other-
have you, and since you went through it, how was your experience? And does it make sense to do more?
Yes, well, first of all, the experience with the department was great. Some navigating some of the local politics takes some deftness, but we were able to do that. And they're built and they are open and they're terrific. And we could probably use many, many multiples of those units throughout Hartford and throughout the state. So it is absolutely worth capitalizing again.
Fantastic.
And
I
again.
appreciate the comment. And again, I will pass that information along to my commissioner, and I can pretty much guarantee we're going to drag you to the table to continue the conversation. So thank you very much.
I
All
see
right.
Jordan just came off.
Yeah.
I see Commissioner Sheff just came on. Yeah.
If I
Commissioner
can,
Sheff,
I just want
please.
to echo. I just want to echo what Commissioner Reeves shared about our success with the original IDASH rounds and Steve's support through all of that. And that we've even without those rounds continued to develop affordable housing that's integrated for people with intellectual disabilities and others around the state. And I have staff on. Elba is also on the call today. She's our housing coordinator. We were doing so much of it, we realized we needed a dedicated housing person. But we have 5 or 6 of those mixed, I call them mixed use housing, and I get in trouble when I say that word. I call them mixed use because they're not dedicated to people with intellectual disability. I know that mixed use is a term of art in the housing community, different than the way I use it. So I apologize that I haven't broken that bad habit, but we have a number of those stood up. We have a number more on the way. We're cracking into some areas of the state that has not traditionally made affordable housing a priority. And it's really making a difference so that people with intellectual disability can live in the communities that their families do, where they couldn't necessarily afford to previously. So, yeah, we're thrilled about that partnership, the one that Hark did when Commissioner Reeves was there, and all the other work that we're doing. And we would like to do a lot more. My friends in Pennsylvania, where I spend a fair amount of time, continue to remind me we can build a lot more of everything but land. So these housing developments that allow a number of people to live affordably in those communities where land is really hard to come by are really value added here in the state of Connecticut, and to the commission, to the governor's vision of this being a destination state, a family value, family centered state. They really speak to that. And, the fact that we talk about middle income affordable housing, that, in other places where I travel, they talk about low income housing, but they rarely talk about middle income affordable housing. And I think we're even making strides there. So I applaud everyone on the team there at DOH, and want to do whatever we can to continue to support your efforts because it benefits all of us.
Oh, we appreciate that. And I see that Elba's got her hand up, and Elba, you're up.
Thank you. Briefly, I just wanted to add that I was actually in the process of writing you an email to let you know that we are interested in being in whatever conversation you're having about, I guess what I would call special populations, the forensics, transitional housing I see is listed here, and certainly the elderly housing. We'd like to be involved in those conversations as well, because as you can imagine, we have individuals identified who have intellectual disabilities who are part of those groups as well.
Appreciate it, Elba, and I believe you are our representative on the Interagency Committee for Supportive Housing and Homelessness for your agency, and we just had a meeting.
Yes.
last week, and look
Yep.
forward to your continued cooperation and collaboration on that committee. So thank you.
Mhm.
Okay. Anything more on homeless before I move on? Okay. This plan also covers HOPWA, housing opportunities for persons with I'm sorry. Commissioner Dalal, please introduce yourself.
Hi, how are you? I won't take the promotion quite yet, but Mehul Dalal, Chief Policy Advisor.
Sorry.
At DSS. This is just a point of information. It may not line up directly with the timeline of an annual plan, but certainly will be relevant for the 5-year plan going forward. DSS, and I know Steve has been involved and other folks have been from DOH have been involved, has embarked on the effort to apply for what is in Medicaid and CMS terms called a 1115 waiver. The 1115 waiver will allow Connecticut to bring federal funds to cover certain services for the justice-involved population. And what we're doing is taking a targeted approach to potentially offer housing and housing supports to the justice-involved population. Now, this is a multi-phase project. Currently, the plan is out for public comment and will be out for public comment until February 8th. And for folks who want to take a look, I can drop the link in the chat after I'm done speaking. But I think it will dovetail nicely with some of this and worth some coordination once it gets off the ground. It probably, we intend to submit the application in April, I believe. So after all the public comment and other work is done, it will take a year from then until we hear from CMS whether it's approved or not. So just want to put that out there as a point of information. Exciting opportunity to bring more resources into Connecticut around housing.
Appreciate that. If you could put the link in the chat, that would be greatly appreciated. Connor, you have more reading. So thank you, and look forward to that opportunity to try to coordinate what we're doing. And there may be a connection with some of the other stuff that we have in the hopper. So thank you. Okay. HOPWA, Housing Opportunities for Persons with AIDS. It's a relatively small program from the federal standpoint. Basically provides rental subsidies to just 24 households in our communities. The state commits a significantly greater amount of resources to the HOPWA initiative on an annual basis. Steve, that's going to continue as far as we know, right? Thanks.
Yep, absolutely. And just a little point of clarification so everybody understands the way the federal government funds it. HOPWA, they actually give more funding to the municipalities. So Hartford, New Haven, Bridgeport, and Waterbury, they get like the millions of dollars, where we get like 250,000. So anybody's interested in HOPWA, particular, talk to your local municipality.
Thanks, Steve. The other two programs covered by this action plan are what we call the major production programs. They actually can do new construction, substantial rehabilitation. They actually work in conjunction with our state bond dollars to create new housing or new housing opportunities. That's the National Housing Trust Fund and the Home Investment Partnership Program. They're very similar programs. The target populations they serve are slightly different. NHTF targets extremely low income households, 30% of the area median income or below. Home can serve and typically serves between 50 and 80% of the area median income households. By leveraging those two programs either together or in conjunction with state bond dollars, we actually get more bang for our buck. When we do projects, we look to do 80-20s or greater. That is 80% affordable, 20% market rate. We also do 90 and 100% affordable housing projects, not just with these programs, but with our state dollars as well. We are all about leveraging. We, in a very long time ago, we used to try to solely fund projects ourselves. We moved away from that model, moved into the gap finance range, where we are a funder amongst many. Affordable housing deals, affordable housing finance is extremely complex. these days. We have a great team of program managers and program staff to work with our development community to get these projects off the ground. iDash was an example where we brought money just for the iDash units in conjunction with a variety of state bond dollars, public investment, and private investment to get those units done. We do that with the vast majority of projects that are in the hopper. And this last paragraph tells you where we are right now. It's, as of December 31st, we occupied just over 1,700 units last year. More importantly, in the number that's not here, we've got about 4,000 units that are actively under construction today. Those will occupy in the next 30 to 180 days. In addition to that, there's another 3,000 units actively under consideration for financing. They are literally spread across the state. They range from extremely low income, 30% of AMI or below, all the way up to 80% of area median income. That is not even touching on a topic which came up a minute ago, middle income housing, which we are doing in conjunction with our sister agency, the Connecticut Housing Finance Authority, or CHFA. They have and are launching Build for CT, which is targeting middle income and the creation of middle income housing that will serve households between 60% up to 120% of area median income. They've got a big announcement later this week. Matter of fact, it may even be today, but I won't steal their thunder. Watch for it. Build for CT is going to be in the news a lot over the next couple of months because it's a new program, but they are pushing money out the door and getting units started and underway. That is where we are right now relative to our programmatic priorities. I'm going to turn this off so you don't have to stare at it. I'm going to put up another document, which is our anticipated budget, assuming that I actually have it open, which I thought I did, and I do. There it is. So we don't actually have our formula grant numbers from the federal government yet. But the planning process requires us to start early. This is what we expect to get for those programs that we just talked about. So for the 6 programs, this is what we got in 2023. This is what we received in 23-24, the current year that we're in. And we expect to get at least as much for those same programs. The federal government has been fairly consistent over the last 11 years that we as an agency have been in existence, with very little fluctuation except for the additional resources we got under COVID, and we got a lot of resources under COVID, and we have successfully expended the vast majority of those funds. So RHP, we expect to get another 1.2 million. That will be the last allocation under the 5-year pilot for RHP. Okay, thus the emphasis, we really need to get those funds out the door. Home, again, somewhere between 11 and 12 million dollars, which, if you think about it, our average subsidy is about $125,000 a unit. So it's roughly 1,000 units that will be leveraged or will be assisted. Right? Is my math right? Yeah. With the home dollars, CDBG, small cities, community development block grant, small cities. Again, we get just under $14 million a year. That really is the largest preservation tool that we have in our toolbox. It really goes, in addition to producing public infrastructure and some diversion dollars, it really goes to support our existing affordable housing stock across the state of Connecticut and keep it from being lost. We talked about Housing Trust Fund a minute ago. Just Like Home leverages at about $125,000 a unit. So somewhere around 40 or so units, right? Yeah. And HOPWA, as Steve pointed out, is a drop in the bucket compared to what goes to our municipal partners. Real quick, I'll run through the anticipated timeline. Our state roundtable, obviously, is today. We have 2 more meetings this week. Public input, community input, and we actually open a 30-day public comment period to take a written public comment from any concerned citizens, partners, advocates, etc. We then draft a plan by mid-February, mid to late February. We then hold additional community input meetings. We'll meet with you again, hopefully, have public meetings, as well as meetings with our other partners. That will lead to a final draft, which will actually be part of a legislative hearing sometime, hopefully, before the end of April, if we can get on the legislature's calendar, with our anticipated submission to HUD for our final approved plan, with all the actual anticipated dollars by May 15th. Our target date being May 15th because HUD has 45 days to review and approve our plan. That with our program year starting July 1st, that's our current alignment and our current anticipated time frame. If we can speed it up, we will. We do our best to try not to backslide because of that 45-day window of HUD's. The key piece to that, however, is HUD does not allow us to submit our plan until they publish the actual formula grant dollars that they are going to award us. In the past, we'd get those numbers in January. Last year, Laura, when did we get them? Late May? So we're going to be ready when HUD gives us the numbers. So comments, questions, concerns overall about anything relative to our plan priorities or the agency in general. And if you and your agency are not a regular partner with us, but want to be, this is your opportunity to let us know. I see Mike smiling. We appreciate your cooperation and your participation, Mike, as always.
Mike, I love our partnership. Can't say it any other way. I love our partnership.
Appreciate it, Mike. It's been a great experience for us as well. I don't know about Steve. I know I have learned so much over the last, I want to say 5 years in particular, about what you do, how you do, the population that you serve, and finding ways for us to help you help them is extremely rewarding. And I want to put that out there to all the state agencies. What we all do is important. We are not what is characterized as a health and human service agency. We're not generally on the front line. But we recognize that what we do has significant impact all across the board. We understand and operate under the Housing First model. That is, if somebody has a stable place to lay their head, all other outcomes are improved. Education, economics, health, and beyond. And we can't do it without your help. And so we appreciate the opportunity to continue to help you serve your population groups. Anybody, comments, questions, concerns, please. Matt, please introduce yourself. Tell these beautiful folks who you are.
Hey, good afternoon, everybody. Matt Puglisi, Deputy Commissioner with the Department of Economic and Community Development. Mike, and I guess this goes to any other agencies as well. One thought I had here was the Community Investment Fund with, the higher volume of applications that we have, at least for DCD programs. As I'm sitting here reviewing them right now, we are seeing applications for all types of specific projects that fit within here. Supportive housing for people with mental disabilities, preventative housing for homeless people, or those that could be homeless because of mental illness or drug addictions, transitional housing for justice impacted individuals. Is taking that data from the first 4 rounds and breaking it out in those categories specifically, is that helpful as you're putting together your next 5-year plan in terms of specific examples, or do you already have this information and it's just repetitive?
Oh, for the 5-year plan, no, absolutely, Matt, that would be extremely helpful. Again, we are looking for, relative to that next plan, any new data streams and data sources that we can get to help us better target and better prioritize where we're going over the next 5-year period. So in particular, if we can get data from you on the SIF awards and, you know, how those projects are going, that's going to be extremely helpful as we go along.
Great, thanks, will do.
Thank you. Anybody, anything else? All right, if after this meeting you think of something you want us to actively consider relative to a priority or a change, please send me an email, send my commissioner a letter if you'd like. I will guarantee you, if you send me the email, we're going to add it to the conversation. If you send it to my commissioner, then she'll send it to me, and then we'll add it to the conversation. So, you know, let's skip the middleman. If you have comments, concerns, questions, priorities, send them my way. Happy to get them. Happy to include them, and very happy to have you guys involved in the conversation. I will give you back 14 minutes of your afternoon. I want to thank you all for your participation. You will hear from us again, because once the draft plan is out, we want to have this conversation about anything else we can do to make it better. Again, our goal is to help you do what you do best. And by the same token, it will in fact help us do our job. Thank you again. Appreciate everyone's attention. Have a wonderful afternoon. If you are out driving, please be safe. I understand the roads are a little hazardous, so be careful. Have a great afternoon, everyone. Thank you.
Thanks, everybody.